They look like dots on a map, but they mean so much more.
Every one of those dots is only moments away from being a fatality.
Here on the shores of Lake Travis, those dots are pivotal to the community's fight against the fentanyl epidemic. It's called overdose mapping.
We can see the data in real time and share that with our neighbors in the public safety realm.
Fire Chief Robert Abbott says the system's identified 2 areas with high numbers of opioid overdoses. And with that information, they're putting Narcan doses in the right places.
The reality is we've had more problem in those areas than we thought.
So how does overdose mapping work? Agencies enter their overdoses into the system, noting where did the overdose occur. Was it fatal or non-fatal? Was naloxone, better known as Narcan, given?
It is a model of response.
When overdoses spike, the system triggers alerts. Emergency medical services can call in extra staff to reduce response times. Hospitals can get prepared for the influx. Treatment professionals can respond to offer help to victims. And for law enforcement, knowing where overdoses occur can lead them to the source of the drugs.
We've seen these great examples of fentanyl drug seizure, and then the 3 months that followed, we were able to cut overdoses in half.
Jeff Beeson with the Washington-Baltimore High-Intensity Drug Trafficking Area Program helped create the system in 2017.
Having that knowledge and that understanding in real time of what's going on in my community, or even a neighboring community, that's going to improve my response protocol and get me in a better position to save lives.
Many departments in the Austin and Houston area have signed on. So has Plano. It's by far the main local contributor.
It's an epidemic at this point, and we are very concerned.
That city saw fentanyl deaths jump from 12 in 2021 to 24 in 2022. But most cities in North Texas aren't doing it.
In order to track it, to understand where it is, where it's going, we need that system, and we need it fully across all of our municipalities in Dallas County.
Right now, we don't get a lot of real-time data.
The Recovery Resource Council covers 20 counties in North Texas.
Oftentimes the data that we're getting is sometimes a year or more old.
So why hasn't Dallas been contributing to the mapping database? For years, as fentanyl deaths went up, the city wouldn't let the department submit overdose information to the database for fear of violating medical privacy laws.
We had a log jam at the city attorney's office, and they were advising the city council to not go forward with it.
Dallas County District Attorney John Cruzo blames former city attorney Chris Queso for the delay in finding a solution.
I don't know of any community that has taken that position about this. Communities have looked at it as a cost-benefit analysis, and the likelihood of being sued on that is so low, and the benefits are so high that people have moved on.
Queso, now in private practice, did not respond to requests for comment. However, the city is now telling us they've devised a workaround. They've routed the overdose information through the county health department, which is shielded from legal claims. And this week, the county began sending it to the mapping system. What about in Tarrant County? They're served by MedStar, which covers 400 square miles. They signed up for the program, but they haven't been able to participate so far.
MedStar was willing to provide the data.
But their information is maintained by another company.
For them to release the data, they want to charge us.
Lance Sumter directs the federally run program that operates the mapping system. MedStar told us ImageTrend, the company that runs its patient care reporting system, wanted $15,000 for the initial connection, plus $5,000 annually.
Couldn't settle on a price that was reasonable or something that I could, as the organization, afford, or that I really think we should have to afford.
After WFAA started investigating overdose mapping, MedStar and ImageTrend this week reached an agreement. MedStar's data will soon start flowing into the overdose mapping system. The MedStar spokesman declined to discuss the specifics, but he credited WFAA with helping the two sides reach a solution.
When we're having young people and old people dying from overdoses, we can't wait a year to find out how bad the overdose circumstance was.
Because those dots could be the difference between life and death. In Dallas, I'm Tanya Iser.